Hey everybody, this is Dr. Daniel Davila, chiropractor with DuPage Pain Management in Willowbrook, Illinois. And in today's video, I want to share a story with you all. So I have a patient I've been working with for a couple months now, and this is a young lady who was involved in a pretty significant motor vehicle collision about a year ago. And unfortunately, ever since that time, she's been experiencing some pretty significant post-concussion syndrome issues, including things like headaches, neck pain, jaw pain, numbness and tingling in the hands. Her fight or flight system is just all out of whack. She told me, I can go work out, and a couple of hours later, my heartbeat is still racing. I'm still experiencing pounding in my chest. And so, over the course of the last year, she's been to different hospitals. She's seen all kinds of specialists, neurologists, orthopedic surgeons, rheumatologists, you name it, she's seen that specialist. And at the end of the day, none of them were really able to give her any kind of answers as far as why she was still feeling the way she was and why she was still having the health issues. They weren't improving despite the treatments that they had to offer her. So she came to see me, and I did my evaluation on her, and I determined that she did have some pretty significant stability issues, especially in regards to her neck. And I explained to her the way that was negatively impacting the neurologic function of the nervous system tissue through the head and the neck, and that this may be part of the reason why she was experiencing the issues that she was. And so she decided to go through and follow through my treatment recommendations. We've been working together for a couple months now, and she did experience some pretty significant improvements, much quicker than I actually expected her to. So this is fantastic news, right? Her headaches and neck pain are going away. The tingling and numbness she was getting in her hands and in her head, they're going away. She's able to work out now, and her blood pressure, her heart respond appropriately. She's all around experiencing a much better quality of life, far fewer symptoms, and she's much happier as a result of it. But the thing of it is, she went to go do a follow-up with one of her neurologists about a week ago. And she came back and she told me, I had a really interesting conversation with the neurologist. He's doing his tests on me, reevaluating me, and he's telling me that, he's seeing improvements, things are getting better in terms of my neurologic function. But then he asked me, what have you changed or what are you doing differently? And I told him, I started working with this chiropractor. That's the only thing I've changed within the last couple months. And she said he literally leaned in and whispered to her, "We don't like those guys. You should stop going there." And then he went right back on with the rest of his what he had to tell her. And she said, "I thought it was really strange that, I'm getting all these improvements. I'm feeling so much better seeing you and doing this chiropractic care. And he's telling me that I shouldn't come back here. Why is that?" Now, this has happened several times to me over the course of my career, that patients have gone to see their orthopedic surgeon, their neurologist, their rheumatologist, whoever it is. And that individual tells them, "We don't like chiropractors. We don't believe in what they do. You should stop going to see them," despite the objectively measurable benefits and the improvements in quality of life that these patients are experiencing through the care that we are providing. And early on in my career, I would have gotten really offended by this. My ego would have been hurt, and I would have thought, how dare they, we shouldn't talk to that person. Don't go back to them. How about that? But ultimately what I've realized is that first and foremost, we as doctors need to be patient advocates before we are advocates of our own treatment methods or our own services we provide. And so what I do now is I just do exactly what I did to this young lady. I just ask her, "Hey, do you feel like you're getting benefit out of what we're doing for you?" And she said yes. And she started listing off all the things she's noticed improving, the benefits she's been getting out of it. And so I said, okay, at the end of the day, that's all that matters to me. Is I know what I can do for you, and I know what I believe can be made better through the care that we offer. But if you don't feel it at the end of the day, then then it doesn't matter. But if you feel like you are getting benefit out of what we provide here, and it's actually seen as an objectively measurable thing, that's all that matters to me. I don't care what they have to say. I don't care what the haters have to say, so to speak, and that's all we have to worry about. And so she's continuing under care. We're actually continuing to see even more improvements for her. But at the end of the day, I think it's important that patients realize that just because another healthcare provider tells you that what we do as chiropractors is not beneficial, doesn't mean they actually know anything about it. It doesn't mean they actually know what we are able to provide to people. And so at the end of the day, if you are experiencing negative health effects, you're experiencing pain, chronic illness, and all these things, maybe it's worth your while to go and get a consultation with a corrective chiropractor and find out, is there something they can do to help you? Because at the end of the day, it may be something that's there for you as a treatment option that you are just not being told about, and it might be beneficial for you. So I wanted to share that story with you all. Thank you for watching. Have a great day. Take care of yourself. Let me know if you have any questions.